Hello, I'm Dr. Renee Reed. I'm a chiropractic orthopedist, naturopathic medical doctor from Clearwater, Florida. I'm practicing as a chiropractic orthopedist in Florida. I've had the occasion to see a patient, Kaley Bishop. She's 20 years old. She has a serious medical condition that has not been handled yet. She has seen 42 physicians, including pediatric neurologist, chiropractic neurologist, acupuncturist, a gamut. She's even gone to Mayo Clinic for a combined treatment there, a consultation from many doctors. She has a condition whereby she has the inability to talk, she salivates, she has a dextroscoliosis, looks to be upper motor neuron lesion, but no one can find a why. Most recently, she's not been able to swallow. She's losing weight for fear of not getting proper nutrition and succumbing from malnutrition. We sent her for a gastric tube, a feeding tube. However, she continued to lose weight. The tube has been taken out, and she's in dire straits and needs help from any professionals out there that may have the key to saving this young lady's life. But I'd like to read a letter from her, and I think this is pretty compelling. She says, "To whom it may concern, I'm 20 years old. Before I became ill, I was very outgoing. I had a lot of friends and helped my church. I was very happy and interested in helping others. When I was 14, I began having trouble speaking. When it first began, my mom would ask me to repeat myself all the time. I didn't understand why. Everyone else understood me, so I thought the problem was with Mom. Then it got worse, and everyone began asking me to repeat myself as much as 10 times. I couldn't make myself understood, and they just gave up caring about what I had to say. I was so frustrated that I wasn't understood. That first year was the easiest for me. The second year was hard on me. My life was basically doctors. I couldn't make plans because all I did was go to doctors. They all told me the same thing over and over again. I was sick of it. I was falling behind in school due to the time and travel required to go to doctor visits. I lost a lot of friends because I had no time for them. I wasn't getting better. The third and fourth years were very much the same. I started slipping into depression. Others began making fun of me. This was destroying my happiness. I sank so low I was beginning to believe I was stupid and I would never be able to talk. I was afraid that I would be abnormal for the rest of my life. The depression grew worse in the third and fourth years. I was in complete misery. I saw no reason to live anymore. I thought life was absolutely pointless. A few months later, I realized something. Something told me that I hadn't achieved my purpose in life yet. I still had to fulfill my goals in life. I hadn't lived life. I didn't know what life was yet. I wasn't really ready for death. Someone somewhere along the years told me the fact I was so afraid of death just proved I hadn't lived life and didn't know what life was. It just hit me that I'm here on earth for a purpose. I have to fulfill that purpose. I need to help people who are like me. People who are better or worse than I need my help to survive. I need to show them there's a purpose in life. Life isn't this dreaded thing you have to carry around. It is what you make of it, good, bad, or in between. Even if you're sick, life can be pleasure or a pain. I've decided my life will have value to me, my family, and others. I am studying to finish my high school diploma as soon as possible. I'm learning sign language to enable me to communicate. I will go to college to prepare for a healthcare profession. If there's anything you wise men and women can do to improve my physical condition, I would be grateful. I will use my life to better conditions for others. Thank you for your attention and consideration. Sincerely yours, Kaley Marie Bishop. This young lady is 20 years old now. We desperately need your help As I said, there are many wise researchers, physicians out there. Your help would be greatly appreciated. You can get a hold of me at consult, C-O-N-S-U-L-T, Dr. Reed, D-R-R-E-E-D, at Tampa Bay, T-A-M-P-A-B-A-Y .R.R.com. My telephone number here is 727-286-6163. Your help is needed. Following this, you will see a video where I gave Kaley a precursory examination. You can see her. She's a beautiful young lady. She needs your help. I urge you, take the time to help save this young lady's life. It will be worth it. So say hello to everybody. Okay. And could you just say your name? Okay. It's Kaley Bishop. And how old are you right now? She's 19. And this condition started at 14, right? And she started to feel her tongue swell. And it has progressed to where we're at right now. I've got with me here, this is her mother, Terry Bishop. And here, you can just get me in the thing, okay? Turn around. Hello, I'm trying to put together all you guys out there, scientists, to help this young lady. All right, let's get back to you. So what we want to do, Terry, if you wouldn't mind, I just want to get a little bit of some information here just to show people where she's at, sensation-wise. Pull this up, hon. Okay. Can you feel all that? Okay, and how about over here? And we're just checking, you know, regular dermatomes. I've already checked these. They're all normal. She's been to 40 doctors, including Mayo Clinic. Just do this real quick, sweetie. So everything there, dysdiadokinesis is okay. Touch your nose. Bring your arms out to the side. Touch it. Okay, and now close your eyes and do it. All right, now just, that's good. Okay, can you whistle? Okay, can't do it now. You used to be able to whistle. So. Do you have any difficulty swallowing? Okay, we do have a little, you know, a little swelling in here for the thyroid, so I'm going to be checking the bromide levels and the iodines, looking for halogens. But, you know, you feel all that? Okay, and then here, can you wrinkle your face? Yeah, hold it there. Good. All right, can you shrug your shoulders up? Excellent. Can you follow my finger with your eyes only? See, so everything's working here. And get cross-eyed. Follow it in. Excellent. You look good cross-eyed. Okay, and let's just check reflexes. And Dr. Martina, if at any time you want to throw anything in here, just go for it. I'm going to turn her over to you in just a sec. So we got good reflexes. Okay, everything's good here. Okay, and let's check the triceps. Excellent. Now, just relax. Okay, excellent reflexes. Okay. Relax, hon. Okay, and we even go to the bottom of the foot. We don't get any situation of flaring of the toes. You know, lift your leg up, sweetie. Okay, that's strong. Pull her up. Heel to your butt. Okay, heel to your butt. Push out toward me. Okay, feet up. Excellent. Feet in. Okay, feet out. Okay, knees together and knees out. Okay, so push your arms up like this. Okay, upper, okay, triceps like this. Push out toward the wall. Okay, hold your wrist back. Okay, wrist forward. You've done this how many times? 40? Fingers apart. Fingers together. Okay, her hands are very cold. They're about 74 degrees, 78 degrees. So I'm going to be looking for that thyroid. I'll hold your fingers apart, sweetie. Fingers together. Okay, index finger like this. Okay. Can you hold it there? Is that a difficult holding it like that? You're getting a little bit of the, okay. All right, got it. So we see a little bit of, yeah, clonus there. So let's hold a little finger. Okay, but all the motor strengths are there, all the sensory's functioning. I know, is this cold? Yeah? How about on your chest here? Cold? How about on your legs? You can feel all this cool? Okay, so we got heat, cold, everything's functioning here. Can you stick your tongue out? Can you lift it up? Won't go up. Okay. Get you this. So there's a difficult time swallowing too? So you're having to blend all your food. Okay. And as far as pupils, right here, open your eyes, sweetie. So there's accommodation. Doctor, why don't you...
Just back to the clonus on the
Yes.
right hand. Any intentional tremor? Intentional tremor?
Why don't you reach out for this? No.
Yeah.
No intention tremor. So, why don't you just pick this up? Okay, none at all. When do you find the hand starts to shake?
Inflection.
Yeah, just inflection. Yeah, writing? With writing, okay.
Okay.
When you make this, what you need?
A piece of paper.
Okay, go for it. All right.
See that change on her left side? That's
Okay.
new. That's only a month old.
Yeah.
Before it was only on her right side.
All right, we got you. Dr. Nelson Marquina, he's an international expert in all kinds of electronics and lasers and diagnostician.
This finger to say yes, okay? And the thumb to be say no. All right. So now, do you feel the body is straight or not? No. Yes. Okay. Good. Okay. How about now? Does it feel? No? Okay. How about now? No. Now I want you to tell me now if it is too far to your right or too far to your left, okay? Too far to your right, to your left? Okay. How about now? Too far to your right. Okay. All right. Now I want you to open your eyes. Just sorry. Just a moment. I'm gonna push your arm. Keep the elbow straight. Okay. I'm gonna push. Let me position your arm. I'm gonna push straight to your stomach. Okay. You're gonna resist. So don't push with my hand. Just resist the motion. So go like that. I'm gonna push to the center. Okay. So just resist there. Got it? You see the idea? I'm gonna push like that. Okay. Hold. Yeah. Hold it again. Okay. Now look straight ahead. Okay. Don't look in there. Hold it. Hold it. Okay. I want you to read this. Just read it. Don't have to. No. Just read it. You don't have to say it. Just read it. Okay. Now this is the same thing. Okay. Hold it again. Hold it. Good. Same thing. You don't have to say anything. Just read the numbers. Okay. Same thing. I'm gonna do that. Okay. Are you getting tired? Okay. Okay. Test the one more. Hold it. Hold it there. Okay. Good. Now just look at the symbol. Don't just look at the symbol. Okay. Do you have problems right, left, confusing, right, left? No? Does she? Sometimes you don't know. Okay. Pointing at hemispheric numbers that was affecting you more. Okay? And this particular muscle that I'm using here is a correlation between that and brain function. So I'm just guessing, pure guessing, because I saw you walking, right? Your feet were a little bit in, okay? And I think you need to do that for stability, right? To kind of to find your way around, to kind of get a feeling for the floor, right? Is that what it is? Yeah. And then in your body, when I was putting you straight, you felt you were crooked. And it was a bias. And right when you were straight, you felt you were too far to your right. So that's why the numbers kind of affected you. And it's all really with the left side of your brain. So that's what I'm doing right now. So do you see what I'm saying? Okay, yeah. So it's possible. I'm just kind of, it's like hunting for secrets. So we're looking for signals and some ideas. So I can, let me know if you can do that, okay? Okay. Now I want you to look at it, but through the eyes. Look to your left. Yeah, hold it. Okay. Now look to the right. Complete. Yeah. Hold it. Does it get tired when you look to the right? It bothers you, yeah? More than when you look to the left, yeah? Okay.
So you're looking for the switched phenomenon?
Yes.
Okay.
Then there also.
I think this health history could help. I spent 2 hours going over it. She had a natural birth. She was breastfed but had trouble nursing the first 9 months of life. She had trouble latching on. Her mother had some breast infections. She couldn't produce enough milk. She used soy formula. She was colicky as a baby, and she had fecal movements that were really smelly. Her mother's 53 years of age, her father's 55. He was a longtime smoker and did consume alcohol. I'm going to get into her personal history starting from birth. Again, we just went over the first year about colic. At the age of 1 to 2, I'll regress. She did start walking at 9 months of age. She hit her head at the age of 2 and had a heart condition where her heart would stop. At the age of 2 to 3, she fell, hit her head, and she was knocked out for 5 seconds. In preschool, everything went okay. In California, from ages 4 to 5, they did live near electrical towers, and she had 8 months of fluoride treatments. In first grade, she was sick with normal flu and cold. However, in the second grade, she was bitten by a tick. She had after that colds and flu for roughly 8 to 10 times a year, and she started to develop headaches that lasted until present time. She saw a doctor who thought the headaches were coming from dust. It was very hard for her to get up in the morning. She would eat and the headache would go away. Usually she would eat oatmeal and eggs. She did not drink a lot of water. However, she did develop pinworms after this. She was anemic and had chest pain. I really suspected here that we needed to look for PCR for Lyme's disease to determine if this was the etiology of her current symptoms. In the third grade, she had headaches 2 times a week. Fourth grade, she had trouble with her math and spelling, and she was foggy thinking with headaches that continued a couple times a week. By the time she was at 10 to 11 in the 5th grade, she had pinworms that were treated. The headaches continued. She could feel them coming on. By the time she was 11 or 12, the colds and flus continued along with earaches. At 12 to 13, she had earaches, colds, and flus. She started to have her period with abdominal pains and headaches and breast pain before her periods. Her periods were short. She started to feel at the age of 13 her tongue feeling funny. And in 2003, February, a few weeks, after she had braces put on. By the time she was 13 to 14, she was having stress from kids at school, and she was failing at school because of her physical health. And this is when she said her problem really started, and she noticed it. Her tongue felt dead, lazy, and fat. In February 2003, she would bite her tongue. Her mother noticed in August of 2004 that her foot was bothering her at the same time. At the age of 15 to 16, she had pinworms. Her amalgams were removed in December of 2007 and January of 2008, and she continued to go downhill. She stated that her tongue function and gait had gotten worse. Her legs became bold. She started to drool and could not control her tongue. She stated to me it was like a snake that was loose in her mouth. Of course, she couldn't be understood. She developed tremors in her right hand, and by March of 2008 to May, the symptoms got worse. By the time she was 17 and 18, she was constipated and was rushed to the hospital. She had many dental caries. From 18 to 19, for up to 3 weeks, she would have no bowel movement, and she had chronic bowel problems for many years. Sometimes she would have tears of the anal tissue. Her sleep cycle has gotten worse over the years. She usually went to bed 9 to 10. She would fall asleep at 10:30 to 11. She would lie there many times. She would wake up from 2 a.m. to 3:15 a.m. or 5:30 to 6 a.m. It took her 30 minutes to an hour to go back to sleep. Sometimes she would go to sleep and wouldn't fall asleep to 3 to 4 a.m. This would happen 1, 2, even 3 times a week. She started to get stomach aches at 18 and 19. She didn't drink a lot of water, and she didn't urinate a lot. She stated she got vaginal discharges. She had many cavities. Her current symptoms are a fat tongue, inability to control the tongue. She salivates. She doesn't choke on it, she said. She has difficulty swallowing, has aspirated saliva, but she's had no pulmonary infections. Her left foot hurts a lot while walking. She gets muscle cramps. She's not able to run. In the dark, she does not lose her orientation and does not fall. Her right hand shakes, and her right hand shakes, and the left 3 weeks after some dental work. The right hand started shaking 2 years ago. Up to 3 to 4 weeks ago, she got symptoms in her left leg. It seems that when she has any dental work, even cleaning her teeth, she gets worse. Right now, she's 5'3", 85 pounds. Her temperature was 100 degrees. I found that her hands were 99.2 and her feet were 85.2, extremely cold. I suspected thyroid dysfunction or an undercut of low iodine or bromide. I checked this out. Her iodine was pretty low and her bromide was higher than the World Health Organization of 0.1 milligram. She does have a scoliosis, a dextroscoliosis. She states her jaws are painful, her tongue is coated. She had full ability of vibratory, heat and cold. Her dermatomes for C1 to C7 were normal. T1 to T5 were normal. Her lumbar dermatomes were normal. She can't extend her tongue to the roof of her mouth. Neck flexion and straight leg did cause mid-back irritation, more than likely from the dextroscoliosis, putting pressure on the spinal nerve roots and stretching the thecal sac. She gets bloated after eating. She does have mid-thoracic pain at the site of the curve. She has a grip strength pressure of 30 pounds in the right and 30 pounds in the left. She does have some tibialis anterior pain on the right. That basically concludes what we found on scoliosis. The cranial nerves appeared to be functioning correctly. She seemed to be oriented in present time. She seems like a normal 20-year-old female with full feelings. There's no mental dysfunction whatsoever. She just can't talk, and she's not able to ambulate correctly. And swallowing is very, very difficult. And I'm pleading to every physician out there, wherever you're at, you could help with this. I'll give you an email address to get a hold of me. Kaley has something she wants all you doctors to take a look at. I hope I can pick it up on here. Let's turn it up. Oh my goodness.
It doesn't focus.
It doesn't
I have
focus.
a laptop.
What she said here, I know you can't read it. It says, if you can help, please do. It's hard to live. It's a hard life to live. I want to get better. All right. So any last thing you want to impart to these doctors? Huh? No? How about a great smile for them, huh? All right.